CMS has proposed a rule to move towards site-neutral payments for clinic visits under the 2019 Medicare Hospital Outpatient Prospective Payment System, or OPPS, and Ambulatory Surgical Center Payment System, or ASC. CMS said that clinic visits are essentially checkups with a clinician and are the most common service billed under OPPS. In the statement issued Wednesday, CMS said it is also proposing to close a potential loophole through which providers are billing patients more for visits in hospital outpatient departments when they create new service lines. The agency is also proposing to expand the number of procedures payable under ASC to ensure that the payment for procedures involving certain high-cost devices equals the amount provided to hospital outpatient departments. CMS estimates that the proposed rule would save Medicare $610 million annually, and patients would pay about $150 million in reduced copays. Here's our take. CMS said more in its press release, but first things first. CMS estimates that it pays $75 to $85 more for the exact same services performed in a hospital outpatient setting than in physician offices. Eliminating the disparity just makes sense. But by leveling the playing field, there would be winners and losers. Large academic systems with a substantial outpatient footprint would be worse off. For instance, CMS estimates that Cleveland Clinic would lose $22 million of reimbursement for outpatient services from 2018 to 2019. Mayo Clinic would be out $11.3 million. On the winning side is Cedars-Sinai Medical Center, which CMS says would receive $7.7 million more under the proposed rule. In general, large physician groups stand to gain from the new rule as well. CMS is also seeking comments on how to best leverage the competitive acquisition program to reduce the cost of prescription drugs. But what really had the Twitterverse abuzz was CMS's proposal to reduce 340B payments in 2019 to non-accepted off-campus departments of hospitals that are paid under the physician fee schedule. Earlier this year, CMS had already reduced $1.6 billion in Medicare outpatient drug payments to some 340B hospitals. Here's some reactions, excerpted from Becker's Hospital CFO report. America's Essential Hospitals said that the proposed rule would, quote, impose draconian new cuts that jeopardize healthcare access for millions of vulnerable Americans, as well as undermine the foundation of support for our nation's healthcare safety net. The American Hospital Association said, quote, in 2015, Congress clearly intended to provide current off-campus hospital clinics with the existing outpatient payment rate in recognition of the critical role they play in their communities. But CMS's proposal runs counter to this and will instead impede access to care for the most vulnerable patients. And 340B Health said, quote, in 2018, CMS slashed $1.6 billion from Medicare outpatient drug payments to many 340B hospitals, a reduction of nearly 30%. CMS now plans to make a bad rule worse by extending the cuts to drugs provided in certain off-campus hospital clinics, including facilities providing infusion therapy for cancer patients and other high-cost drug therapies to treat chronic and life-threatening conditions. Not everyone criticized the move, however. Dr. Farzad Mostashari, founder of the ACO accelerator Aledade, said in a prepared statement, quote, this will level the playing field between independent practices and huge healthcare systems. While hospitals undoubtedly will oppose this new rule, they should welcome it, as it could help them become more competitive in value-based payment contracts, which is the future of healthcare.
Here's what else you need to know. Apollo Global Management will acquire LifePoint Health for $5.6 billion in cash and debt. Apollo will merge LifePoint with RCCH Healthcare Partners, another hospital operator the private equity firm owns. The newly combined system will operate under the LifePoint Health name and will be led by current LifePoint Chairman and CEO William Carpenter III. The new entity will be headquartered in Brentwood, Tennessee, where both LifePoint and RCCH are currently located. If the deal is approved by regulators and LifePoint shareholders, LifePoint will operate 84 hospitals in 30 states, primarily in rural areas, with 7,000 affiliated physicians, 60,000 employees, and an annual revenue of more than $8 billion.
On Tuesday, CMS said it is restarting the Health Insurer Risk Adjustment Program with an interim final rule, which will allow the agency to provide $10.4 billion in risk adjustment funding owed to insurers. As reported previously, a federal appeals court in June ruled that the Health and Human Services Department was not obligated to pay insurers the more than $12 billion in risk corridor payments that have accrued to date. CMS said, quote, This important step fills a void created by a federal district court's vacating of the previously issued methodology and enables the agency to resume the CMS-operated risk adjustment program in the individual and small group markets.
RWJ Barnabas Health and Rutgers University officially launched their public-private partnership to form an academic health system. While the two organizations aren't officially merging, RWJ Barnabas said it would be forming a comprehensive medical group, including employed physicians and other healthcare professionals from RWJ Barnabas and Rutgers Health. According to a statement, RWJ Barnabas Health will invest $100 million initially, and then more than $1 billion over 20 years to expand in the education and research mission of the integrated academic health system. RWJ Barnabas will also fund the construction of an ambulatory care center in New Brunswick and a new clinical and research building for the Rutgers Cancer Institute of New Jersey. Rutgers currently operates the New Jersey Medical School and the Robert Wood Johnson Medical School.
Baylor Scott & White Quality Alliance announced its largest commercial ACO contract to date, after it reached an agreement with Blue Cross and Blue Shield of Texas for 140,000 members in North and Central Texas. Blue Cross and Blue Shield of Texas said it now has more than 1 million lives under value-based care agreements. Baylor Scott & White Quality Alliance, Baylor Scott & White's ACO, is one of the nation's largest ACOs, with 600,000 covered lives, 6,000 physicians, and 50 hospitals.
Reuters reported that the Trump administration has proposed a rule that would scale back or eliminate protections that allow rebates between drug manufacturers and pharmacy benefit managers. HHS Secretary Alex Azar and Dr. Scott Gottlieb, head of the Food and Drug Administration, have publicly questioned whether rebates provided by drug manufacturers should remain protected by federal law. According to Reuters, on Wednesday, HHS sent the proposed rule to the Office of Management and Budget, but details haven't been made public.
Google appointed former Cleveland Clinic CEO Dr. Delos Toby Cosgrove as executive advisor to the Google Cloud Healthcare and Life Sciences team.